afternoon, everybody. My name is Vita Skuja. I'm a clinical gastroenterologist and endoscopist from Riga, Latvia, and today I'm really delighted to be together with my lovely colleagues and friends, Martina, Rina, and Iago. And all of you, at least as far as I know, you are all fully working gastroenterologists, full-time working gastroenterologists, are involved in science and actually are holding up some very highly positions, both nationally and internationally, and in UEG as well. So I know you from National Societies Committee, where Martina is a chair, and we are all part of this. And today we are here to talk about burnout. And as we know that burnout is a really, really serious and also very important topic nowadays, and I think that all of us have been in a plenary session where actually it was the first talk with what UEG week was open, hospitals in crisis, and we know that burnout is a part of that. And if we talk about burnout, then we define it as a state of mind which is characterized by intense depersonalization, exhaustion, and a decreased sense of personal achievement. And if we look at the numbers, maybe you have read the articles, of course, as well, then the burnout in gastroenterology is somewhere between 18 up to 64%. And I think that's really high, because if we compare it to other fields of medicine and medicine in general, where it's about 45, then I think the burnout in gastroenterology is in really high numbers. And I'm also very happy that all of us are kind of coming from different regions. I know that Martina, you're from Germany, you're from UK, Rina, and Iago is from Spain, and I'm from Latvia. So we kind of give a broad geographical perspective, also female and male perspective. Young versus more senior and experienced ones. So I'm really happy to meet you here. And first of all, I would like to ask you how you would describe a typical workload and responsibilities in everyday life of a gastroenterologist. And maybe, Rina, you can start on this.
Thank you, Vita. So let me give a more senior perspective. So my typical working week does involve a combination of clinical activities, and that's a mixture of clinics where I see patients, telephone or face-to-face, a mixed endoscopy list, and then I also have more specialized endoscopy of capsule endoscopy and an enteroscopy list with an anesthetist. And on top of that, I also have multidisciplinary meetings where we have meetings with surgeons and radiologists, an IBD virtual biologics MDT, and then there's also patient-related admin, which is surmountable. I also do on-calls, where we cover a regional bleed service, and that's a consultant delivered. And then I also supervise juniors, and they are clinical fellows and medical students. And within my working week as a full-time clinician, although I do academia, I don't actually have dedicated time apart from 4 hours. So it's quite a huge balance, and I have to say that as a full-time mom, a lot of it I do in the evenings.
Yes, this sounds a lot. And one thing I think I didn't mention in the beginning, that we all have families, and we all know the struggle of balancing actually our work, our life, our maybe personal interests and goals, and the family. Iago, maybe you can add something to that as from the junior perspective of you. What does your typical work day look like, or your work week?
Yeah. Yes, because, and I totally agree with your comments, because we are always presenting ourselves as full-time gastroenterologists, but we also have families, and we have to combine this. So in my usual week, I usually are also taking care of patients with IBD, mainly as Rina, but I also have my endoscopy list. But I am really, really lucky to have a 40% of my time dedicated for research. This is not typical. I'm really lucky to have this time for research, but usually young fellows, young trainees, or those young colleagues starting their careers, they are not as lucky as me with this time for research, and usually are taking care of patients with gastroenterological problems 100% of their time. So this is really, really the thing. When you are a young fellow, you are usually starting to have a family or planning to have a family, you have to be looking for a good position for your work. So those are, I think, special situations in the young fellows also.
Yes, yes. So as far as I see that in the senior perspective point of view, there are very many things that need to be managed. And from the young perspective of view, there is always a question of, do I have more time to learn and grow, as far as I hear from your stories. And maybe, Martina, you can talk a little bit about common factors that contribute to the workout. And maybe you can add on top of that. Yeah?
Yeah, it was very interesting to hear the senior and the junior perspective. And indeed, the juniors are more affected. And this is something that calls us to action. And this is very important to know. Why is this so? We think that junior doctors, they do really more perceive maybe a lack of personal achievement. And that's a cause of burnout. And this is why it's very important to really draw all our attention on this topic. It's critical for the gastroenterological community and the medical community as a whole, because we do not want our junior trainees to leave our field.
Yes. Yeah, I can totally agree. As far as it looks, that this burnout is not a question of today's thing. It's also a question of future, of what we will have in the future. Maybe you have some additional things. What do you think? What are the factors that contribute to the burnout?
Yeah, so I see factors that contribute to burnout can broadly be divided into three themes. So there's the working environment, there's the job workload, and then there's personal factors. In terms of the work environment, if you work in an environment where the managers are always breathing down your neck, it's a competitive environment with colleagues that are not very nice, that adds to lack of support in a workplace. And I think across the board, most hospitals and healthcare systems struggle with IT. So, and doctors then spend a lot of time trying to navigate through that, lots of additional activities. In terms of the job workload, I think it's really important that you are satisfied with what you're delivering within the week, because if the workload is too much for what you are, for a typical working week, then you feel overburdened and you end up bringing work home. And the third factor is on a personal level. It might be simple things as a parent, commuting to work. If you have to drop your kids and commute to work, and it's a long commute, that adds to the burden. And also for some trainees, it might be financial implications. You would have all heard about the number of strikes in the UK. And finally, I think, as Martina already said, job satisfaction. You must have a sense of achievement, and the job has to remain challenging. Otherwise, you're not going to enjoy it.
Yeah, sure. I can maybe add also from a young perspective of you that if you are learning, of course, there will be more failures, let's put it like that, and you have to be ready for that. That's a part of the learning process. Therefore, maybe the young people are more prone to burnout. But is there something more, Iago, that can be as a factor of factors that can contribute to burnout?
Yes, and also especially with the young fellows and those people, also seniors, willing to do more and asking more for your work, like research, academia, as Rina was saying. Well, this requires more time, more organization in your work life. So there's no very well recognized work or usually in our environment. So this is also driving to young fellows not undergoing a proper research career most of the times, at least in my environment. And also adding to your comments, I think that you have a few options. You can not be working full-time as a clinician. You can ask for a reduced time in your hospital, but there's no flexibility if you're willing to go for your kids for a couple of hours and to have a small time with them and be more flexible like in any other company. So usually hospitals, I think, they are not so flexible as we would like to also.
Yes, that could be the case. And also, I think that you already kind of started my next question about the coping mechanisms. And I think we can divide them into personal and maybe institutional. And maybe this is one of the places where hospitals can actually help us. Maybe Martina or Rina, you can start on the coping mechanisms or the strategies that we can imply or something that we can do to make things better.
I think it's very important to address both. the individual and the system.
Yes.
And please always remember, physicians, that's what the World Health Organization said, are community leaders. So we should really, and I'm very humble and grateful that I have a profession which I like so much, that I have a family and that I can do clinical work, teaching and research work. And I'm grateful for that. And I'd like to convey that to all future generations of gastroenterologists.
Yeah.
And this is why we have responsibilities as leaders, and we are all leaders in this system, and we should really tackle the individual and the organization. How can we do that? I very much like a Hawaiian study. These were Hawaiian nurses, and they said we should get rid of all the stupid stuff. Rina commented on that. So that is, all the daily IT struggles, all the documentation work. And this is a study, and there are data out. This served 70,600 hours of nursing work by a simple intervention, and they called it getting rid of the stupid stuff.
Yeah.
And that's what we should aim at, reorganize our organizations to help the individual. And this is our responsibility as leaders in the field and as UEG or as a member society.
Perfect. Yeah, thank you much. I think it just adds to the speech about hospitals in crisis, where this was the main message about doctors as leaders. So yeah, thank you for explaining it further.
Yeah, and the message is also there is shortage of healthcare workers all over the world.
Yes.
There is the epidemiology, but there are also all the possibilities in medicine. And we have to reorganize our system to help the individual.
Yes, exactly. And yeah, maybe there's something that you can add on top of that about the coping mechanisms.
Yeah, so I think what Martina has already said is great. So I think I would say coping mechanisms can broadly be divided again at society level and then at the hospital level and the personal level.
Yes.
At the society level, I think UEG has a great mentoring program. So I would completely advocate that because that helps the individual realize they might have potential in other aspects and also maybe help them achieve career and job satisfaction and maybe embark into a different area such as research or academia.
Yeah.
So I think that everyone should take the opportunity that the UEG offers.
Sure.
And the UEG also offers in terms of grants and awards, and that's another means to try and achieve something else from the current workload that you do.
Yeah.
In the workplace, things that can help, Yago mentioned about working flexibly. I think that's really important, particularly for young parents that have young children, and also try to ensure that the job that you do fulfills everything.
Yeah.
And if you're not happy with the job plan, speak to your bosses to try and adjust things. And then there's a personal level, which we all, have to do little steps to help ourselves. And I can say from my experience, I do things like meditation and exercise and running.
Yeah.
And, that really helps.
Perfect. And I like how all of you are jumping to my next questions. My next question was, what are you doing personally in your life? So you already explained. Maybe, Iago, you can tell some of your tips and tricks. What are you doing in your everyday life? Because let's be honest, we are our habits, I think so. So what are your habits of preventing burnouts?
Well,
Yeah.
I think they can also be divided, as you were already saying, that those are individual level, but also in our job or hospital level, because in the hospital you can have those habits or those traditions to improve your well-being, because we are speaking about burnout, we're speaking about working better, better conditions. So it's like being even better. Well, you don't need to get burnout before implementing these things. So, well, you have to be working in a place which is attractive, the activities that you can develop, attractive activities in your field of interest. So the head of your department or your leaders need to be rewarding and giving you something because you are developing things and putting an effort in some of these activities. So it's going to be also beneficial for everyone. And also teamwork. I think it's very, very rewarding to work together, improves the working conditions and all the feelings that you have with your peers. But all these things are impossible without personal balance and personal well-being. And usually, for example, we have Enrique de Madaria. He likes to work and to do hundreds of things, and he has also a blog speaking about how to do it. And well, you have to reserve some space in your life for sports, for your family, because those are the pillars, and you can only be working 100% of the time. So I think you need to keep this space because it's going to improve your mental health, which is important. Rina, we have been speaking about this, which can be crucial if mental health is involving healthcare providers. So you need to keep this balance with your personal life always.
Yeah, I think it's always a question about our agenda, about our calendar. How much time do we block for those things? Because I think we all know, and it's a thing that we all know that this is important. But what do we actually do to do those things? And while listening to you, I remember Finland. I think has a great example of how to do the work-life balance. And I know myself, I have been in Oslo, Scandinavia. I think that really when the work ends, they are home with the kids. They're running, they're doing sports, they're baking gingerbread houses. It was Christmas time when I was there, and I really find it interesting. And from the Finland point of view, I remember that we already talked also in the National Societies Forum that the legal issues are also a big burden. I mean, all the legal cases and all the complaints, and I think you can take and actually you have to have more hours to deal with those things as well. I think that this is also a regional thing. But Rina, I think in your home country in UK, you have some things already implemented as from the hospital or from the organizational level.
Yeah, so I think in the UK we're quite lucky. There are definitely lots of resources for people to access within the NHS. There's several groups and self-help, and also in the national, we've got what we call a well-being scheme, so people can access that to help themselves. I think at a more personal level, to all the young listeners out there, as a more senior gastroenterologist, I think in a working week it's really helpful to have a to-do list so that you make the most out of the week and you ensure your priorities that you're going to achieve that week are met. I think working flexibly, trying to juggle lifts with parents, but also really important, I think, to make sure you carve enough time for the children. Might not just be to make gingerbread, but and also you can incorporate fun things like exercise with the kids. So you're spending time with them, but then you're also dealing with mental health and helping yourself relax. So I think those are really good tips.
Perfect, good. Martina, maybe you can tell us more about maybe the long-term consequences of having burnout, and also I think it involves both the personal and institutional and the whole healthcare system level.
First of all, I'd like to come back to Jago and to Rina and to state that clinician well-being is paramount for the quality of patient care. And this is why we really have to take into account the individual and the system. As individuals, as clinicians, we strive always to improve population health. We strive to enhance patient experience. We have to reduce costs. We have to reduce inequities in the healthcare system. And we have to improve the work life of healthcare workers. Why is this so? Because conversely, burnout, which is the absolute negative form of non-well-being, has a meaningful impact on the quality of work. And there's an amount of data out that shows that physician burnout results in, to sum it up, reduced patient care, reduced quality of patient care. It leads to reduction of empathy. And this is not what we want. So this is what Jago said, to be there for your patients, to be a leader, a community leader, you have to be in a state of well-being.
Yes.
Otherwise, the consequences have a direct impact on patient care.
Yeah, it's like in the airplanes, they say,
Yeah.
put your own mask
Yeah.
first, and then
Yeah.
you can
Yeah.
help the patient. And I know that UEG is doing a lot to prevent the burnout. And actually, I know that since, I already told that you're all part of National Societies Committee, and we are all part of National Societies Forum. And we have, set this as a priority. And since Martina is the chair, I'm sorry again, I'm giving word to you. Maybe you can briefly tell what UEG is doing, to prevent burnout. Yeah.
First, I'd like to thank the NSC and Jagon Rina for supporting me. And I had a lot of talks with the 49 countries that are members of the National Societies Forum, and that we are thankful to chair for the next 4 years. And each of the participating countries, and we have said that already, heard it in the opening session, shortage of healthcare workers, epidemiology, and this calls us to action. What is it that UEG will do? UEG is committed to advancing the professional well-being of the European GI workforce. We are going a comprehensive approach. We started with a workshop together with the National Societies Forum, and I'm very grateful about the positive and overwhelming response that we received for this workshop. And with the results of these workshops, we aim to identify factors contributing to well-being and specific factors leading to burnout among health workers in the field, and that is very, very important to develop solutions. And it's different, depends on the different countries, and we are going to take a comprehensive approach. We need more data. So our next step together will be, under the guidance of Jago and Rina, to conduct a survey, and we are hoping that 49 countries will participate. We'd like to do it as a pan-European effort. And with the data of this study, we'd like to really, really develop potential solutions and also to involve stakeholders in the field.
Yes, yes. Great, good. Do you have something to add to that?
Yeah. So I think the UEG's done a lot. So just to go in terms of think about the young talent group. So the young talent group is very active, and I think they help to encourage young researchers to be involved with the UEG and in getting positions and applying for grants. And I think that's really helpful to ensure that young researchers and clinicians have an interest outside of the work, and that helps keep them encouraged and motivated. Secondly, the UEG has got an equality and diversity plan, and within that plan itself, one of the main objectives is to try and introduce more innovative working time models, and that will certainly help young parents.
Definitely.
And hopefully that will be implemented pan-European. And then on the NSC level, as Martina has already alluded to, the survey, we will find data on the scale of the problem across the disciplines, not just to gastroenterologists, but all the allied specialities, and also what our members really want from us, from the UEG. Well, how can we, as a UEG, support the community? And because, as Martina is saying, we are representing a huge number of countries, we will provide resources, which might be web-based initially, but then maybe more small groups at the next UEG week. So watch this space. We will expand what we have.
Exactly. Jago?
Yes, and because UEG is an umbrella of different people with different specialities, organizations, backgrounds, ages. So this will give us a great overview about who is at risk, who is suffering or not suffering, and the working conditions, who should we be focusing in the future. And probably some countries are not so much at risk, but others need more help. So this is, the perfect context to develop this kind of ideas and proposals. So I think this is a huge opportunity for us to improve the working conditions, to improve how we all love our job, so improve how we are working. So hopefully in the next few months can provide more data about this.
Great. I'm really happy. I feel safe now. I really feel safe. So yes, to conclude everything, I think thank you very much for the wonderful talk, and I get many ideas from you that I will definitely go on and implement. But I think most importantly, it starts with us. It starts with our habits. It starts with what we do. And when we have got our everyday life and our habits in order, we can always look out and see how we can contribute to the society. And I think that UEG is always open for new ideas, and I think that NSC will also be happy. National Societies Committee will be happy if you want to join in. I think they will be happy to basically to give an opportunity. So yeah, thank you so much. It had really a pleasure, and have the rest of the Congress. Thank you.
Thank you.
Thank you very much.
Thank you very much.
Yeah.